Go ahead.
Good afternoon. I'm Deb Newman, President and CEO of the Bangor Region Chamber of Commerce, and we are live here on Facebook, ready to take your questions, especially pertaining to employment law, as many of you as employers and business owners are trying to navigate this rapidly changing landscape. I'm grateful to PCHC. They're letting us be here this afternoon. We're being very mindful of distancing and sanitation and doing all of those important things that we all need to do today. We have two guests joining us, Anne-Marie Story with Rudman Winchell. Rudman is our partner in this. Anne-Marie specializes in employment law and is doing the best job anybody can do to keep up with all of the changes and to answer the many questions that are coming in from you. And joining us from PCHC is Dr. Elizabeth Valley-Mock. Dr. Mock, if we may refer to you as Dr. Mock, would be great. Thank you for being here today. So if you have any health questions, we're here to take those as well. Again, this landscape is changing by the hour. This is the third time we've offered this seminar, and we're doing it because you're telling us you need the information and you have a lot of questions. I'm going to start by having our panel just give us an update as to where we are and their thoughts about what it is that you should know. So why don't, Anne-Marie, do you want to go first?
Sure.
Okay, great. Thank you.
So since we were here last, at that point, the Family Medical Leave Amendment and the Paid Leave Act were brand new, hot off the presses. It's been now a couple of days. We've had a chance to kind of go through them, although, again, there's a lot of lack of clarity in some of the provisions, but at least we have a little bit more understanding about what these are going to require and what employers are going to need to do to comply. Both become effective as of April 2nd. I know that people have a lot of questions about them, and I'm happy to answer those as best I can. There's also the unemployment statute that I think we talked in detail about last time. I know that many people have already started making applications. Employers are trying to help people out with that. So I'm interested to hear if people have had experiences, what those are, and if there are questions about those as well. And on it goes, it changes every day, but we're keeping up. So just a caveat, I'm here to answer questions. I'm happy to do that, but I'm doing it in a hypothetical kind of way. I'm not giving advice to any one particular person, so please don't pose a question that's specific to my job or my child or my, whatever. I'm trying to give the best general oversight I can of the laws and answer general questions for folks.
Okay, thank you. Making sure that are we live? Yeah, we are going, okay. Thank you for that. We are following your questions. I know some of you can't really hear us that well. We're trying to speak up. We're doing this low tech, low touch. So please turn up your volume. If you have earbuds, you might want to try those. That might help you be able to hear us better. We'll do our best to speak up so you can hear us. This is your opportunity to ask your questions. We'll be monitoring your comments right under the live video feed on the Bangor Region Chamber of Commerce Facebook page. If you know other people who would be interested or have questions, please invite them to join us. We can take as many as we like. That's the nice thing about virtual seminars. With that, I'd like to introduce our doctor in the house today, Dr. Mock. Thank you for being with us. This is the first time you've joined us. Again, this is the third seminar we've hosted. Can you just give us an update from your perspective where we are in the state with COVID-19?
So I think the thing to think about is obviously a lot of us can see all the different graphs and numbers online, and we see that we're on the bottom of the upside of a really steep curve. And I think that's the biggest thing from a public health standpoint for us to remember is we hear people saying, oh, it's not here, or there's only 3 cases in Penobscot County. You need to know that over the past couple of days, labs all over the country, including in the state of Maine, have started to run out of testing equipment. So we have markedly decreased the amount of testing that we're doing. There is much less testing available, very stringent criteria to get testing. So what does that mean? It means that if you're not testing people, you're not going to see the numbers of people who have it. It's here. There's a lot more people than we have positive tests, and it's going up a slope that pretty much looks like it's going straight up at this point. So don't be fooled into thinking, oh, well, there's 0 cases in Aroostook County. It's in Aroostook County and it's coming. And the numbers are going up more than exponentially, really, every single day, doubling in less than 24 hours in some places. So that's now is the time for us to make a lot of important changes in the way we live every day, and not say, well, it's not here, I don't need to worry. You do need to worry because you don't know where it is.
Thank you. Anne-Marie, question for you coming in onto our Facebook. Again, post your questions in the comments under the video on the Facebook Live feed. If you'd like to ask them privately, you can also send a message. We have several people in the room who are monitoring that. Trust me, it's a big room. Mm-hmm. We're all spread apart. We were all checked before we came in. We're using all the proper sanitation, washing our hands, sanitizer, and not touching our face. It's the hardest thing to do. Tracy asks, if I have employees who have wives or spouses already at home with their kids, do I have to pay them through the FMLA leave as well if they choose to stay home?
Well, the new paid family leave doesn't specify whether, it's not a judgment call for an employer to make about whether or not the employee is really necessary to be there. The law provides that leave, and I think I'm just flipping to it to make sure I get the language right. So it talks about, let's see here, 10 weeks of paid family leave at 2/3 the employee's regular rate when an employee is unable to work due to a bona fide need for leave to care for a child whose school or child care provider is closed or unavailable for reasons related to COVID. I would not recommend that an employer get into a judgment call about whether that person's really needed to be there if a spouse is there, because you don't know what the circumstances are for the spouse. They may have it themselves, they may not be able to care for the children. I think as long as they fit the criteria here, you should give them the required leave.
All right, thank you. And we are trying to work on the audio. We know it's a little challenging. We'll get the iPad as close as we can, speak up as loud as we can. Crank up your volume if you could. Another question for Anne-Marie. If an employee is out due to school closings, should they apply for unemployment? So perhaps the business is open but the school's closed. Should they apply for unemployment? Also, would the employer still be responsible for paying the emergency paid sick leave while employee is waiting to see if they qualify for unemployment?
Okay. We're going to take that one piece at a time.
All
right, so the first part of it was if an employee is out for reasons, for child care related reasons, should they apply for unemployment, right?
Correct.
So you just have to go back again to the criteria. The criteria for unemployment, one of the criteria is that an employee is able and available for work. If they are not able to work because they are needed for child care, they may not be eligible for unemployment. However, I would recommend they apply anyway, because that's the call for the Department of Labor to make, not me, not you, and not the employee. So I would still encourage them to apply. But if they're not able and available for work, they may not be awarded those benefits. So the second part of that question was what? Should they apply? Are they entitled to the FMLA provision?
Stand by, because I was just looking. Oh, here we go. Would the employer still be responsible for paying the emergency paid sick leave while employee is waiting to see if they qualify for unemployment?
Well, yes, because if they qualify, well, wait, so you're not, because if this is the same person who was out for childcare, so now you're talking about 2 more laws, because they may be eligible for the family medical leave, not the paid sick leave. Because the paid family medical leave is the one that applies when an employee is needed to care for a child who can't be in school or daycare. So it seems to me that that would be the more applicable. The first 10 days of that leave are unpaid, after which it is a paid benefit. So you can, an employee is entitled to run their accrued time during that 10 days to make up for that unpaid period. You can't require that they do that. if they apply for unemployment and they're awarded unemployment, then unemployment would likely offset whatever paid time they choose to use. But the timing is going to be unusual probably, because as I understand it from the DOL's webinar last week, it's taking 10 to 12 days for the first unemployment check to arrive, which means that that first 10 days is still going to be unpaid, and then they'll recoup that money on the other end. So I still think that it's not for an employer to make that decision about whether or not they should, so they should encourage them to apply for unemployment if that's what they want to do, or at least don't discourage them, and allow them to run whatever paid time off they have if they want to do that during the first 10 days of unpaid FMLA, after which point it would be paid.
All right, we're going to give you a little break and a breather. I just posted, the Department of Labor recently put out a good fact sheet. Amory, you've probably seen it,
Yes.
with some questions and answers. So I just posted it as a link right under this live seminar. I will say that all of the government agencies, DOL, DECD, Governor's Office, they're all really trying to, SBA fame, combine communication efforts and put it in one place, because everything's happening so quickly. And one of the things that they're doing is, if you go to maine.gov, on the home page you'll see a link to the governor's page, and that's where they're trying to deposit all of this information from the various agencies to keep it simple. So that's constantly in progress. A couple of medical questions regarding COVID-19. We'll shift over to Dr. Mock. One question I received was, somebody had the flu in February. They weren't tested. They just suffered through. It lasted a really long time. They had many of the symptoms that they're saying go along with coronavirus, COVID-19. And they're wondering, is it possible that they had it, but this was before we were really talking about it? This was February timeframe. Is that a possibility?
So it's an interesting question, because in February we did not have documented spread in much of the United States outside of the state of Washington, and then towards the end of February to the state of California. So it really depends on travel history. Were you in Italy and then you came back in February and you got sick? Then a lot higher likelihood. You know, did you come from China because you were there for New Year's festival? And so it really matters. If you live in Penobscot County and you never left Penobscot County and you didn't meet anyone who had traveled anywhere and you were sick back in February, most likely it was a disease that was endemic in our community then, which was not COVID. There's no way to know for sure. It really depends on you and your exposures and where you were and who you were with and who you had close contact with. But can you assume it was or it wasn't? You can't. You don't know. So just like everyone else, you should be employing the same social distancing as everyone else now. So I think the only benefit, if you knew for sure you had it a month ago, was you would have some immunity to it now.
Right.
But other than that, there's really no benefit to knowing whether that was true or was not true, and you probably will never know.
Interesting. Another question for you. This came in to comment on our live Facebook feed. Our dental office is only seeing emergency patients. Can our dental assistants assist in other positions, such as administrative tasks, reception, screening patients, etc.?
So I would say that that would be on an individual office basis. Many dental offices are independently owned and operated, so that would be up to the owner of that office to decide what was appropriate for their staff who are not working clinically right now to be doing instead, to try to preserve some time for them and to allow them to work. You know, if you worked at a dental office like PCHC, then there's a really big organization sort of governing how your tasks are going to be and where else in the organization can you work. So it really depends on what situation you're in, what office you're in. This morning I work in addiction medicine at PCHC, and our volume was down quite a bit. And so I said, well, this is a great time to work on that policy that we've been meaning to put together for the past 2 months, but we were so busy seeing patients that we really haven't looked for best practices from other places and thought about how would we implement. It's a great time to do something like that. So if you are an employer who can afford to keep your staff at work, things like that might give you an opportunity, deep cleaning, seasonal stuff that you always meant to get to. That would be a good thing, but it's gonna depend on each independent person, how they're affiliated and how they're licensed, how they're going to be used.
All right, thank you. This was helpful. Anne Marie, back to you, and I will also mention I reposted that link to the Department of Labor just as a individual post on the Bangor Region Chamber of Commerce Facebook page because it was getting lost in the comments, so it's up there. They're coming in fast and furious. Stand by. I had a good one for you. Well, they're all good. Very good questions. And the question was, I'll find it here.
While you're looking for that, let me just point out, so this doesn't get lost, because most people won't know to ask this. The emergency sick leave law has a provision in it that requires employers to post a notice discussing its provisions. The Department of Labor is supposed to issue that within 7 days of the law becoming effective. So, or actually after it was enacted. So we are expecting that at any time. So employers should be aware that as soon as that notice is issued, it needs to be posted in all of their workplaces.
Would you repeat that? What do we need to post in all of our workplaces?
It's a notice. The Department of Labor is supposed to be creating a model notice that they're supposed to issue no later than 7 days after the act was enacted, which of course was last week, about the paid sick leave law, and that's required to be posted. So as soon as that comes out, employers will need to know and will need to get it posted. So we'll, of course, do our best to send out a blast as soon as it comes out, and so employers should be on the lookout for that.
Okay. There's several questions about the work share program. Know anything about that?
In what context? You mean unemployment, or?
Let me dig a little bit. We'll go with another question right now. One of the questions was, once we start getting back to business, which hopefully won't be too far down the road, and we start bringing some of our employees back, will that jeopardize unemployment for the other employees?
Well, I don't know that jeopardize is the right word. We haven't even thought through that process yet because we're still in the midst of laying off. The law indicates that it is intended to be and has to be a temporary layoff with an expectation that once this is resolved, people will come back. Now we're totally speculating, but I don't know that there would be any provision saying everybody has to come back on the same day, and I'm sure that won't happen. My guess is it's going to be a matter of how a business ramps itself up once this is over and people can go back to work, and recall will be based on maybe staggered. It may all be all at once. It's just going to depend on the situation.
And I don't know if this is a question for Dr. Mock or Anne-Marie Story. The question is, are healthcare workers exempt from the paid leave law?
I can address that.
Ask me about telemedicine.
All right, so I'll take that one. The law has a provision in it that says that, let's make sure I get it. I'm going to find it so I can read it and make sure I get it correct. It says employers of employees who are healthcare providers or emergency responders may elect to exclude those employees from the emergency sick leave provision. What it doesn't say is how you go about doing that. And I have seen at least a suggestion that the proper way to do it is to seek permission from the Secretary of Labor or the Department of Labor. Without just excluding them right off the bat. But there is no guidance about that yet. We are waiting for and expecting guidance from the Department of Labor that is supposed to be issued prior to April 2nd when these laws become effective. And I'm anticipating that it will answer hopefully many of these questions, including that one.
Okay. I'm having a little trouble seeing all of the comments, so I would ask maybe Brian if you could. You see some good ones in here, just ding me. text me or whatever, so we can get to as many as we can. Another health-related question, Dr. Mock, many restaurants have shut their doors, but they're still doing business through drive-through pickup and delivery. And several people have asked, not on this fee, but I've heard the questions asked me to ask you, as a customer, first of all, they want to support their area restaurants in a big way. So as a customer, they want to go, they want to get the pickup, they want to take the food home. Is there any special things they should do to protect themselves? Should they worry about the pickup containers, any contamination in that respect?
So I think the best thing to do in that sense is, number one, you have to assess your own risk. If you are over the age of 70, if you have a high-risk health condition, if you live directly with those people, then you need to be even more vigilant than someone else. I live in a household with 2 healthcare providers and 3 teenagers. So we consider ourselves relatively low risk and relatively highly likely to become exposed at some point. So do we worry a lot about our takeout containers? We don't, because my elderly mother with asthma luckily didn't jump on the idea that she should come to Maine to beat this 3 weeks ago, and she stayed home alone in her own house, which is the best thing for her right now. In retrospect, that was stupid for me to ask her to come to my house where I can take care of her and keep her safe, because my house is not the safest house, right? So if I were high risk, I think I would be really careful. I would handle the containers, I would maybe transfer the food with a utensil, and then I would wash my hands. You've all heard Dr. Shaw, who is an amazingly brilliant physician, and we are so lucky to have him here in the state of Maine. But what he says repeatedly is, wash your hands like you just sliced an entire bag of jalapenos, and then you're going to take your contact lenses out. So after I handle something from the outside, then I bring it in, and then I would wash carefully. And if I transferred everything, trying to sort of limit the amount of touch points. The same thing with groceries. Every single grocery item was put on the shelf by a person who touched it, and multiple different people touched it. So there are ways to think about going through the grocery store process. And if you go through a conventional line, then the cashier is touching each of your items again. So as much as I might not be fully supportive of self-serve lines at the grocery store because it takes away an opportunity for employment, right now maybe I am a little bit supportive of that, because that's one less person touching each of my groceries, because I'm scanning them myself, I'm bringing my own reusable bags, things like that. So it's just really being conscious of all those things and your level of risk adversity when we're supporting local restaurants, when we're getting takeout, when we're going to the grocery store, when we're going to the gas station. So all of those things. I try to think of, I had to drive to New York to pick up my daughter. Thank goodness we argued for a week about whether or not she'd move out all of her stuff. And I said, yes, you will, and finally we did. And now she lives with me. But on the way to New York, I said the inside of my car is a safe zone. The outside of my car is not safe. So whenever I get back in the car, I open the door handle, and we luckily still had some hand sanitizer at that point, and we would wash our hands before we touched anything inside the car. So we kept the inside of the car safe, and we considered the outside of the car not safe. And there were no phones that were allowed to leave the car when we went to the rest stops. When the food came in, as much as we could, we would, try to limit the handling, things like that. So it's just all of those little steps, staying away from people, being careful of door handles. That's the most we can do. Estimates are that about half of us will become exposed to this just in the course of general life. We're trying to decrease that number all at once. We're trying to spread it out so that we don't overwhelm our sources. We're not necessarily going to change the end numbers, but you've all seen the graphs. We're trying to get rid of the really high mountain, and we're trying to make it like those worn out Appalachian foothills, because then we'll have enough room in the hospital. That's all we're trying to do.
Thank you. Great reminders there. I know many folks are just staying put and not venturing out to grocery stores and other places, but those of us who still have to do that on occasion, wash up, sanitize, wipe the cans down. great advice. Some really good questions coming in. This one, Anne-Marie, this individual sounds like works for a business that has not closed and doesn't, perhaps she or somebody else doesn't feel safe working in the building. What do you do in that situation?
Well, again, you go back to what do these two new laws cover, and will they cover that person? So that person would not be covered under Family Medical Leave Amendment because they're not caring for a child who's out of school. And so then you go back to the 6 provisions of the emergency sick leave law, which actually do not cover that situation. And I've had that a lot because, just to go over them again, the reasons why an employee can take this emergency sick leave: number 1, they were subject to a quarantine or isolation order. Number 2, they have been advised by a healthcare provider to self-quarantine. Number 3, they are experiencing symptoms of COVID-19 and are seeking a medical diagnosis. So that does not arguably include somebody who has a cough but isn't sure what it is and just wants to go home just to be sure. Number 4, an employee who is caring for an individual like a child because the school is closed, so that's the same as the family medical leave, which overlaps. And number, I don't know what number I'm on. Somebody caring for somebody who fits within one of the earlier categories, somebody caring for a child, and then the last one, we don't know what this means. An employee who is experiencing any other substantially similar concern.
That's clear.
So, I don't know what that means. Maybe that person that you've described fits within that last section. Arguably, they do not. So if you're now facing a situation where the employee is not subject to the family medical leave and not covered by the emergency sick leave, I think what you do is you follow the CDC guidance, which is if I'm not comfortable working here, I can go home as long as the employer can do without me, and I'm looking at probably taking whatever accrued time I already have, and then it's unpaid time. Because that person is unlikely to qualify for unemployment because they're not able and available for work. They're removing themselves from the workplace for a reason that's not covered here. And I don't think they would be entitled to unemployment, although they could try. So then it becomes a judgment call by the employer. Do you try to force somebody to stay in the workforce who's not comfortable being there? Or do you let them go and use unpaid time? I think the first scenario is almost unworkable at this point because number 1, if they don't want to be there, they're not going to be productive. And number 2, if they don't want to be there and they leave anyway, then you're in a position of having to either terminate them or give them the leave they asked for in the first place.
Yeah.
I mean, it's a hard situation because we also need coverage. We need people to still be working, whether it's from home or in workforces that are still permitted to be out there. So I'm not saying it's an easy answer, but that's really what it's going to come down to. You let them take unpaid leave, or you're going to potentially face terminating.
Now, for those trying to figure all of this out, are you reading from, are these state laws, federal, what are we looking at?
Well, the two, the FMLA and the sick leave are both federal laws. The unemployment, of course, is state.
Okay. And the federal level, they're still looking at trying to put some legislation through, some acts through, some emergency legislation through to help. Do you think that any of this will change?
Well, as of right now, these are the laws. They don't become effective until April 2nd, but they've been passed by Congress. They were signed by the president, so they're not going to change unless there are amendments to them once they become effective.
Okay.
But as of April 2nd, those are the 2 laws that apply.
And
unemployment's already in effect.
Where is the best way for anybody to get this information in a format that's understandable?
That's a good one. You're funny, Deb. Your best, without being flippant about it, your best sources are both the state and federal Department of Labor.
Yeah. Okay. And just like we go to the CDC for facts, that's what's really important right now, is to go to the most trusted resources for information.
I think, yes, of course. And I also think, this is what I tell my employers all the time. When you have an issue come up, you don't panic, you don't assume. You've got to take it employee by employee, because they may all be entitled to different benefits under these laws. And then there's the regular FMLA, so you can't forget about that, because that still applies. So if I have the virus myself, I may now be entitled to emergency sick leave and my FMLA time, and potentially now I'm a person with a disability, and maybe I have a comp claim that I'm going to make. So it's not easy, but you've got to just look at it employee by employee, and almost have a chart. Now, don't ask me for a chart. I've tried to make one in the past, and it looked like something my daughter drew, because you can't plan for every eventuality. But I think that's the best course of action here, because every employee situation is likely to be different, and a different law might apply to them.
This is related to the government, federal government. Is the emergency paid sick leave to be paid by employers and then reimbursed by the government, or is being reimbursed not approved yet?
I'm no expert on tax issues. Let me make that perfectly clear. What I do know is that the leave law has a provision in it where there is some payback from payroll taxes. And I read a very complicated factual hypothetical about how that money would be paid back. I'm not going to profess to understand it. But there is some provision that there is a payroll credit that is intended to make up for the amount that they're paying out. I don't know if it covers the entire amount, but it is out there. My best advice about that is, if an employer has a payroll specialist they work with, or a benefits person, or a accounting firm, that's the place to go to talk about that.
Okay. And just a reminder who you're hearing from. We're grateful to have Anne-Marie Story here with Rudman Winchell, specializes in employment law. And Dr. Mock is here from PCHC. Elizabeth Fallymock, is it Fal? Okay, thank you. Falmock, I apologize. And I'm Deb Newman with the Bangor Region Chamber of Commerce. You can follow along on the Bangor Region Chamber of Commerce Facebook page. After this is over, we will post it. Thanks to Shelley Sund and Brian Kotler, who were here from the Chamber, and Karen Sichters, who's here from Rudman. And I assure you, it's a huge room. They're nowhere near each other. There are many questions coming in. We'll do our best to address as many as possible. Department of Labor is a great resource, some good information there. I have a question about, hang on, I just lost it. We know there's a shortage, I don't know who, maybe both of you can take this, of PPEs, personal protective equipment, masks, gloves, protective eyewear. We're seeing that around the country. We're getting requests from healthcare providers to see if businesses have them, and hopefully there's more coming. I know, just from watching the news, the federal government's trying to work on that. Somebody asked the question, oh, I lost it. Really? Can you find it, Brian?
I've got it where it's coming in.
Stand by. While we're finding that question, if an employer, Amory, if an employer has greater than 500, oh, I lost that one.
I can make that up.
Okay, go.
If they have more than 500 employees, are they subject to the emergency sick leave law? And the answer is no.
That was easy.
That may be the only clear answer for the day, but.
That takes care of all the healthcare providers.
Right. Where,
You got it?
Chatted it to you.
yeah, the emergency sick leave applies to private sector employers with fewer than 500 workers. There is some provision in there about potentially exempting out employers with fewer than 50, but again, that's a determination to be made by the Secretary of Labor, not by an individual employer. My understanding is that you have to have a special waiver and show the impact on your business of providing this leave. Again, hopefully that's something we'll know more about in the regulations.
Okay.
about PPE.
Yes, here's a question, and now I'm getting them better on my phone, so I'm gonna go that route. Due to the shortage in PPE, we are utilizing only the appropriate PPE for the requested care of a patient. What if a healthcare worker is requesting additional PPE beyond what is required? They're not doing the testing, so got employees who want more protection, the equipment's not available, so healthcare employers are trying to figure out how to divvy it up in the right way. That's a tough one.
It's a really, really difficult question because everyone feels like they're at risk and everyone feels like they're vulnerable. So I think about trying to divide things up and compartmentalize things in terms of if you have employees who are public facing or patient facing or forward facing, if you have employees who are definitely at very high risk, then maybe they are the ones that need to be manning the back lines. So I have a partner who's in their 70s who is, I would consider, pretty high risk, and I would volunteer to work that person's shifts for them because I don't want that partner on the front lines. And maybe that partner can be providing some backline assistance. So number one, think about the people and where you're putting them and what you're asking of them. The second thing is we're working really hard as a system. One of the nice things is we already had in existence the Bangor Community Health Leadership Board. Am I saying that right?
Yeah.
And that kind of grew out of the opioid crisis. So we had already formed this network where we were working among the different systems. And so already having had that in place, it was really easy to ramp it up in terms of collaboration among the different systems. And as you know, the three major systems are Northern Light Eastern Maine, St. Joseph's, and PCHC. But having that framework in place has really helped. So the idea is that we can set up locations where these people who have these symptoms go here, and these people who have these symptoms go here. And among different organizations, they might have one office that's designated for completely outpatient care related to nothing related to the respiratory system. So you would call first and you would be directed to go to this primary care office instead of that one. So by cohorting like that, we can also help maintain some of the equipment. So if we have someone who's forward facing, like in the emergency department on the respiratory side, they can be in the equipment and that one person can have a mask on for their entire shift or something like that. So that's one mask, one person, instead of having 10 different healthcare providers scattered around doing the same task where you need more equipment. And the truth is there is a shortage. We hear about it all over the country. We haven't experienced it here yet in Maine because our disease burden isn't as high as other places. I just hope that some of the very things that make Maine difficult to recruit and retain employees are going to be the most protective right now. We're at the end of the road, right? If you don't count Canada, we're at the end of the line. We're hard to get to. There's not a lot around us. We're rural, where our population density is low. All of those things I'm really helpful will be the protective things for us. So our numbers might not look as bad as other places. That being said, I tell people we have what we have and we have who we have. So we need to be really, really careful and thoughtful because we hear what's happening in other places. So don't throw things away. Look at the ways people have been creatively using things. There's been a lot of movement to have people at home sort of reach out from their hearts and sew masks from fabric. And as far as I can determine, talking to lots of people around the country, those might be helpful for people who are patients and community members who might have very mild symptoms but need to run out to the store because they can't get anyone else to go. But in terms of protecting healthcare workers, regular fabric, although the CDC has offered that as sort of a last resort, is not the safest thing. So our hope is if we've had warning here, we've had time to get ready in Maine, we've had a slower start to our race here. We've been seeing what's been happening in Washington now for up to 2 months, really. They really had the start in Washington State. So lucky us that we're on the other side, that we cannot throw things away and we can think about how can we utilize this and how can we take one nurse and let that one nurse for one shift use all this equipment instead of multiple other people. And I think that's that's the best plan that we have right now. I think it's different, and things change every day, and things in Boston are different than things are in Bangor, and so we need to stay up on things and be careful about it. You know, if I'm not feeling well and from whatever reason and I have a respiratory mask, I'm going to treat that like gold, and I'm not going to throw it in the trash until it's visibly soiled or completely unusable. And if I'm lucky enough to have an N95 mask in my possession, I'm gonna sure as heck treat that like gold, and I'm gonna have it so that I can take the most precious care I can of it, because it's a really important thing to have if I go into a situation where it's been determined that it would be helpful. That's largely in the intensive care unit, and it's largely in the emergency department. Those are the biggest, highest risks. So someone in an outpatient office, much less risk to be exposed to aerosolized disease. We talk about when people get on the breathing machine. That's a huge risk time when we're intubating patients. Those are the people that we need to make sure we have the largest amount of equipment for, and then you kind of move down that ladder of risk. We're all at risk. As healthcare workers, we're equally at risk to go to the grocery store, perhaps, than we are to go to the hospital on a normal day. And so we have to kind of weigh that. I had a friend who said, I've trained my whole life for this moment. And so it's kind of neat to think that here we are in this day and this time. I thought the opioid crisis would be the defining moment of my career. Because
Right.
I didn't ever intend to become an expert on opioids, and by accident I became an expert on opioids. And I thought, this is my whole life led up to this. And now I have the opportunity to try to be as helpful as I can in something that I maybe never envisioned.
Thank you. And huge thanks to everybody who's on the front lines in healthcare. We appreciate everything that you're all doing in a big way. Anne-Marie, we're getting a number of FMLA questions. Under the FMLA, the first 10 days is not paid. Can the employee be paid the 10 days under the Emergency Paid Sick Leave Act?
Yeah, so that's an interesting question. As long as they qualify for both, then the only way they would do that is if the leave is solely related to the need to care for a child who cannot be or is not in daycare or school. So if an employee is in that situation, it does appear that they may be able to collect both or be covered by both the emergency FMLA and the paid sick leave law, in which case the first 10 days would probably not then be unpaid because they could utilize the emergency sick leave during that 10 days, and then the remainder of the time would be paid. So then the question is, which are you paying under, because the pay is at different rates for both laws. Because why wouldn't it be? So we don't have the answer for which, I mean, my guess is, because every time you apply the FMLA, when you're trying to distinguish between state and federal, you are charged with providing the employee the greatest rights to which they are entitled. And so it may be a matter of figuring out how much would they be owed under paid leave, how much would they be owed under FMLA. But remember that paid leave is only 80 hours. So once they use up the first 10 days under paid leave, there's only going to be so much left of that, and after that it would revert to pay under the FMLA.
Okay, thank you.
Good times.
Yeah. This is a sort of a similar question. We've had it before, but it's coming up. Does emergency sick leave cover someone who makes a decision they should self-quarantine due to underlying health conditions, even if their industry is considered essential?
So we went through the 6 qualifying factors just a little while ago and said that it doesn't appear on its face unless the employee is seeking, unless they are experiencing symptoms of the virus, seeking a medical diagnosis, have been diagnosed, have been ordered to be isolated, or caring for a family member or a child. It does not appear as though that's a covered reason unless the end-all number 6, an employee who is experiencing any other substantially similar condition. We don't know what that means, and hopefully the regulations are going to tell us. But from the clear language of the act, it does not appear to cover somebody who's under a desire to leave without being under an order to do so or being advised by a healthcare provider to do so. However, I mean, if somebody had a heart condition and their doctor said you really ought to be isolating because you're at a higher risk for that, then I think that would be covered.
I was gonna ask if there's a legal difference between isolation and quarantine, because we see them as different things.
Oh, that's good. So
Yeah,
the
that
question
is good.
Is there a difference between isolation and quarantine? The two words.
So let me just say so the act says an employee subject to a coronavirus quarantine or isolation order. So maybe you can tell us what those mean.
So, and it says order though.
Yes.
So it sounds like if you've had a reasonable exposure, then you might be asked to self-isolate. Quarantine's a little bit higher order where you've had a definite exposure and you're at significant risk of developing symptoms. Isolation, I think more of you had recent travel and you feel perfectly fine, but upon arriving home, you stay at home and you don't come into contact with people for 14 days. I think of that as sort of a voluntary isolation, and I think of quarantine as a little bit more mandatory. It can be by a court order, but generally it's like your healthcare provider has told you to stay in a place and because you're at significant exposure risk. So I think of them as levels, but I don't know if legally they're actually different. And then we're all doing self-isolation. We're all doing, my kids like to call it lockdown because it sounds more fun that way, I guess. But we're all doing the shelter-in-place order, which is not a whole lot different than the isolation. They're like tiny little stair steps.
And that's interesting because it doesn't say what the order is or where it comes from. So it may be that the governor's order to be self-isolating unless you're in a certain profession would be sufficient, but I don't know that. And it also breaks it into two categories. So category 1 is an employee subject to a virus quarantine or isolation order. And then number 2 is an employee who's been advised by a healthcare provider to self-quarantine. So that, to me, that says that is not within number 1. So number 1 is something different than a provider saying you should self-quarantine. It's almost like the next step up.
Mm-hmm. Question, real easy one.
Yeah.
Right.
There are no easy questions.
Real easy one, and then one, well, they're all, yeah. What's the minimum number of employees for the new FMLA to be effective?
There is no minimum.
There's no minimum.
And you mean that, I'm getting confused as a layperson. There's the new paid leave law, and there's the quote-unquote old FMLA.
There's an amendment to the existing FMLA. Right. Which ordinarily the federal FMLA ordinarily only applies when you have 50 or more employees. But this amendment applies to all employers with fewer than 500 workers who have been on the job for at least 30 days.
Okay.
So
I have a
it
question,
is different.
and I think I saw it too, but doesn't the state unemployment emergency legislation allows for employees who do not feel comfortable at work and don't want to go to work, they can file.
Anybody can file, and then it would be up to the Department of Labor as to whether or not the filing qualifies as one of the reasons. I guess ultimately the question that's going to come down to is whether or not the person is able and available for work. And if I'm removing myself from the workplace, am I available for work? But it doesn't hurt to file.
Right, and well, I don't want to try to quote anything without having the facts in front of me, but I did share on the Bangor Region Chamber Facebook page a really good PDF from the Department of Labor that answers a lot of these questions. You're not the first to ask these great questions, so they're trying to respond to them as they come in and get that information out to you. So check out that link, go to maine.gov /GOL, or just maine.gov and find the Department of Labor site. They
I actually have that in front of me.
Oh, you do? Maybe
Yeah.
you can find that out. They are, they've suggested that they would prefer an email if you have questions rather than phone calls, because you can imagine they're probably getting a lot of questions. But we can look at that too. If you select not to work, your employer's open, you're not comfortable working, you have underlying health conditions, whatever the reason may be, can you apply for unemployment?
So actually, here's the answer, and lucky for me, it's exactly what I said.
But you love that.
Because you're good.
And it's not really an answer, to be honest with you. The question posed in the DOL's publication was, my boss is allowing me to take an unpaid temporary leave of absence because I'm considered high risk for the infection if I stay at the office, even though I am not sick now. Would I be able to collect unemployment until I'm able to go back to work? And the answer is, you may be eligible for unemployment benefits during a temporary unpaid leave of absence if you are expected to return to your job at the end of the leave, and provided you remain able and available to work for your employer. So those two things don't match up to me. Because if you're choosing not to be there, you're not able and available for work. So I don't know what that means, but I still would encourage somebody to apply.
Yeah, and I think my read on it, and I'm not a legal person by any means, is hopefully they'll call people back to work when it's safe to go back to work.
And then they'll be able and available.
Then they're able and
Right.
available. If you haven't been permanently separated from work, you're sort of just
Right.
not working right now because of the situation, you're still connected to that employer. That's my understanding of it.
Well, and there may be an argument that I'm not able to work. See, that's the downside of it, because if there was an argument that I'm not able or available, meaning I'm removing myself from the workplace, so I'm making myself not available, then that could be a basis to deny. But if they're looking at it in the way you suggested, which is, that means when the employer's ready to call me back,
Right. I'm able
I
to
must
go.
be able and available, then I think they probably would qualify.
Yeah, because I think what they're trying to do is follow the guidelines of the recommendations from the CDC and get as many people home and safe and out of circulation, if you will. So that's how I understand it.
Well, and certainly the advice is apply, because
Yeah.
all you can do is try.
I also mentioned just a plug. Wednesday morning from 6 to 9, I'll be co-hosting a show on WVOM with Rick Tyler, answering these questions, and we will have the Commissioner of DOL on the show. So Commissioner Fortman's joining us. Any questions like this, you can call in. These are some good questions I know I can ask. Anne-Marie Story will be joining us as well to take your questions. We have Commissioner Johnson from DECD, SBA, FAME, Senator King. We're about close hopefully to confirm Senator Collins. So we'll find out what's going on to help you at the federal level and the state level and take your questions. So that's on WVOM 103.9, 6 to 9 Wednesday morning. We'll be putting out information on our website, so tune in, because no doubt the questions are going to continue, and we can't get to all of them in the time we have. We will try to wrap up in just a few minutes, but if you have questions we haven't answered, we will try to get your answers for you. Do you know much about the payroll tax credit yet?
I don't.
Okay, so that's something that we'll look into for you. Again, on that show, we will have the federal delegation joining us, so they can fill us in on what they're trying to do at the federal level to help employers out and businesses out. We'll have more information on that.
I mean, we know that there is one under the sick leave law. It's just a matter of, its application is not something that I'm familiar with.
And several of you have asked about support for nonprofits, and I believe there is something in the works. We don't have enough information to share with you, but we'll look into that, and I'll ask that question on Wednesday.
Yeah, I think one of the issues is for employers who are direct payers for unemployment. They are not getting the credit back that employers who pay into the system are getting. And I think that's one of the things that they're hoping to correct.
Right. So they're looking at all of this.
Yeah.
I'll also mention that FAME, if you go to, FAME will be on the show Wednesday as well. If you go to famemaine.com, they've just put out a loan program for individuals and sole proprietors. If you're a sole proprietor and now suddenly you can't, your business is shut down, it's some money to help pay the bills. You can borrow up to $5,000 up to 3 times, so up to $15,000 total. That is flowing from state government. Maine, Fame Maine is administering the program, but it's available at your local bank or credit union. So talk to them about that. That can help you get through these challenging times if you're a sole proprietor and you can't file for unemployment or an individual. We only have a few minutes left, so I thought I would toss it back to our guests. Anything that we covered a lot of ground, but if there's anything that you're thinking you want to repeat or that you haven't mentioned that you'd like to leave with us before we wrap up. Dr. Elizabeth Balmock with PCHC, we'll start with you.
So I think I would just encourage people, especially seeing as you in the business community with all of your acronyms that are different than mine in the medicine community, this is an extraordinary time, and it's something that combines elements of, number one, I think of obviously the Spanish influenza epidemic of 1918, and then it combines the stock market crash of 1929 and the Great Depression, and then it combines elements of deprivation and national ramping up of structures of World War II. So you take all of those 3 together and you put them together, and this is what we have now. And it's really to look at the numbers and to look at places like Italy where they were not able to implement things more quickly. I can't imagine anyone who hasn't seen a story of Northern Italy, but if you haven't, pick any one of them about how tragic it is to be in that place at that time right now. And that's what we're trying to avoid. And it's painful and it's financially devastating for so many people. But there's only one other alternative, and that's what we're seeing there. And so as difficult as it is, I think, for those of you who are parts of communities of faith, for those of you who do meditation, this analogy of we're walking in the wilderness for a long time, for 40 days or 90 days, we're walking through, but we're walking and we're going and we're doing it together at arm's length distance. And we will get to the other side of this. We know that a lot of this devastation, especially to our global economy and national economy, is going to take a couple of years to come out of. But it's what we're trying to prevent, and we only need to look there to see where we could be and where we're hoping desperately not to become like. That's the greatest example when people say it's not here and it can't happen like that here. It can. We're just behind them, but we're catching up more rapidly than anyone would have guessed. So those are the things, for as difficult as it is, for as difficult a decision as it is to make, to lay off to someone, to close your doors and to stop the complete flow of revenue into your place of work. All of those things, as difficult as they are, hopefully as a greater community, we're going to figure out how to get past this and how to get through this.
Well said, thank you. Thank you. Anne-Marie Story.
I have 2 things. One is, we talked last time about what happens when somebody in your workforce is diagnosed and the obligations you have to people who work around them, also to clients or customers or other people who may have come into contact with them. One thing we did not talk about that the CDC has also added to the list of things for you to do is to have a professional cleaning company come in and clean all the areas where that person has worked, has existed, has touched, all of those things. So I wanted to be sure folks, as we get more and more of these cases, it's going to become more relevant. And then my last thing is, everybody likes to joke about my cold little lawyer heart, but even I had a moment last night of pretty much full out panic. What I will leave you with, though, is that it's okay to have those moments, but then you gotta move on. And the best way for employers to handle, because I'm an employer too and I'm going through the same thing, you've got to take it one step at a time, one employee at a time, and do it right for each person. And hopefully we can help you figure out how to do that.
Right, and right, it's so hard to know what's right, because we've never done this before.
Well, that's true, and that's why you have to step back and think about all these different laws that apply, and think about, you know, the nature of your business, what you need, what your employees need, what your obligations are, and how best to meet those. I am never gonna say this is easy, but I think the more reasoned approach you can take to it, the better off you'll be, the better off your employees will be.
And I would just thank you. I would just add that everybody that we work with, we know at both our federal delegation and state government is just working 24/7 to help you, and looking at all of these existing laws, and looking at programs, and trying to get new programs out quickly to find you relief, to get us through this. But you're right, you know, if we can mitigate the health impact, then we can hopefully mitigate the damage to our economy as well, long term. So thank you, all of you, for everything you're doing, because I think we're all going through anxiety and stress,
And don't forget to watch the penguins.
right, the penguin video will make it all better for a while. And that said, it's pretty amazing to see how people are coming together and helping each other. And as a chamber, that's what we're here to do right now, is to just help you in any way that we possibly can. And we're figuring out day by day how we can do that. So we're open to your suggestions. We'll discuss if we want to continue offering this to you, and in what format. Again, it's day by day. In the meantime, you know, reach out to us with any questions, and we'll do our best to find you the answers. And thank you to our guests and PCHC for allowing us to be here today. And thank you for joining us. We appreciate it.